Okay, real talk for a sec. How many of us out there,
Mm.
honestly, enjoy getting our blood drawn? I mean, needles, the sight of blood. Not exactly a day at the beach, right?
Right. Not usually anyone's favorite activity.
But think about it. Have you ever considered the person on the other side of that needle? The phlebotomist. The one who's making it as quick and painless as possible.
Yeah, they don't always get the appreciation they deserve.
Exactly. They're the unsung heroes of healthcare, right? I
Right.
mean, they're skilled professionals playing a crucial role in your health journey.
Absolutely. And in this deep dive, we're going behind the scenes of phlebotomy, a field that's way more intricate than most people realize.
It is. And a huge thank you to London Heartbeats Academy for partnering with us on this.
Yeah, they're fantastic. They're an amazing resource for anyone, really, who's interested in healthcare careers, with over 140 courses to choose from.
Wow, 140, that's a lot.
It is. So definitely check them out if you're looking to maybe, expand your healthcare knowledge or considering a career change.
Absolutely. And don't forget to follow them on Facebook, Instagram, Spotify, and YouTube. They have tons of free resources and updates you won't want to miss out. Okay, let's unpack this, shall we? When we hear phlebotomy, most of us probably just picture those needles, right?
Yeah.
But is there more to it?
There's a whole lot more happening beneath the surface. You could say that literally. Phlebotomy. It comes from the Greek words for vein and to cut.
Oh.
The phlebotomist is the one gathering those vital clues. They don't just collect the blood. They also prepare those specimens, making sure they're properly labeled and stored for accurate testing. They're also the ones interacting with patients, helping to put them at ease. Especially important for anyone anxious about needles.
I can imagine. I mean, a good phlebotomist can really make all the difference. I remember being terrified of needles as a kid, and this one phlebotomist was so patient and kind. Completely changed how I felt about it.
It really is about the human touch, isn't it? Especially in healthcare.
It really is.
And it's not just phlebotomists who need this training, by the way. Doctors, nurses, even medical assistants.
Oh, makes sense.
Anyone who might need to, at some point, collect blood needs to understand the proper techniques. It's a foundational skill across the entire healthcare field.
Makes sense. So let's walk through that typical phlebotomy workflow. What's involved from the moment a patient walks in to when those blood samples are, ready for analysis?
Okay, so it all starts with patient interaction, proper identification.
Right. That seems crucial.
Oh, it's absolutely crucial. Yeah, you got to avoid mix-ups. I mean, those can have really serious consequences.
You're talking about, like, getting the wrong blood test results.
Exactly. Yeah, imagine that. It could lead to, well, incorrect diagnoses or even dangerous treatment decisions.
Wow, okay. No room for error there.
Nope, absolutely not. Then, of course, the main event, right, the blood draw itself. But even that seemingly simple step, it involves a whole series of precise actions, ensuring both patient comfort and that the sample's good.
Okay, you've piqued my interest. Walk me through it. What exactly are those actions during a blood draw?
All right, so after, confirming the patient's identity and explain it's about to happen, the phlebotomist preps the equipment, chooses the collection site, usually a vein in the arm. They then clean the area, apply a tourniquet to make those veins more visible, and then carefully insert the needle, collecting the blood into these color-coded tubes. And finally, they remove the needle, apply pressure to stop the bleeding, bandage the site, and dispose of the, sharps.
Wow, it sounds straightforward, but I'm sure there's a lot of skill involved in making it look that effortless.
There definitely is, and it's not just about technical skill either. Maintaining that professional demeanor throughout, it's paramount.
Now, this is where it gets interesting for me. Why is professionalism so important in phlebotomy? I mean, beyond just being polite, of course.
Well, think about it. For many patients, the phlebotomist is their first interaction, really, in a healthcare setting. So their whole attitude, their approach, it can shape that patient's entire experience, even influence their perception of healthcare as a whole.
Right. If the phlebotomist seems rushed or dismissive, that could set a negative tone for the whole visit.
Exactly. And confidentiality is huge, too. I mean, phlebotomists are dealing with sensitive medical information, right? So discretion and respect for patient privacy, it's essential.
They're kind of like the guardians of our blood secrets.
In a way, yeah. So it's not just about the technical stuff, it's about the human element as well.
So true. That calm, friendly, reassuring demeanor can make a huge difference, especially for those who might be a little anxious, right?
Huge difference. Don't underestimate the power of a simple smile and a kind word either.
It's the little things sometimes. And of course, there's the safety aspect, which is, paramount in any medical procedure.
Absolutely. Safety is a top priority, both for the patient and the phlebotomist. We're dealing with blood, which means, well, there's potential risk of exposure to bloodborne pathogens.
Okay, now my stomach's starting to churn a bit.
Yeah.
What exactly are bloodborne pathogens? Why are they so dangerous?
These are, well, microscopic organisms, essentially. They can cause diseases, and they're present in blood and other bodily fluids. Some of the, I guess, most well-known would be HIV, hepatitis B, and hepatitis C.
So even a tiny drop of blood could potentially transmit
It
those.
could, and that's why those safety precautions are so strict. And needle stick injuries, those are a major concern. If a phlebotomist accidentally sticks themselves with a used needle, there's that risk of those pathogens getting into their bloodstream.
Oh, wow, that sounds scary. Any other ways these pathogens can be transmitted?
Yeah, so contact between contaminated fluids and mucous membranes, like your eyes, nose, or mouth,
Uh-huh.
that can also lead to transmission. So it's not just about needle sticks. It's about being really aware of any potential contact with blood or, other potentially infectious materials.
So how are phlebotomists and other healthcare workers protected from those risks?
Well, the Occupational Safety and Health Administration, or OSHA, has established very specific guidelines.
OSHA.
Yep. One of the most important things is mandatory bloodborne pathogen training. That's for all healthcare personnel, anyone who might be exposed. It covers, well, everything, really, from understanding those types of pathogens to handling sharps and contaminated materials.
So it's about education and awareness, making sure everyone understands the potential risks.
Exactly, yeah. And a key concept in that training is what we call standard precautions.
Okay, what does that mean exactly? How do those protect everyone involved?
Standard precautions mean treating every bodily fluid as potentially infectious, no matter what. Regardless of the patient's, known health status, think of it as a universal safety net. You assume everyone might be carrying something, even if they seem perfectly healthy.
So even if you think someone's healthy, you still take the same precautions.
Yes, always. Always better to err on the side of caution. We're talking blood, semen, vaginal secretions, fluids from around the heart, lungs, abdomen, all handled with the same level of care.
So no exceptions.
Well, I guess, just to clarify, sweat and tears, they're generally not considered infectious.
Good to know. So what are some specific actions taken to maintain those standard precautions?
Okay, so the most obvious probably is personal protective equipment, or PPE. That's, gloves, lab coats, sometimes even face masks, depending on the situation. Think of it as a barrier, between you and potential contaminants.
I've definitely seen those blue gloves in action. Any other precautions?
Hand washing, absolutely essential. It's really the simplest yet most effective way to prevent the spread of infection.
Okay, I'm guessing there's more to it than just a quick rinse, though.
There is, yeah. There's a specific technique, making sure even microscopic pathogens are washed away. It involves thoroughly lathering up with soap, scrubbing all the surfaces between your fingers, under your nails for at least 20 seconds. And even to avoid recontaminating your hands, you turn off the faucet with a paper towel.
Wow, I'll admit that's more detailed than my usual hand washing routine. Makes sense, though, when you're dealing with, potentially infectious materials. What about after the blood draw? How is all that waste handled safely?
Everything is carefully categorized, disposed of according to guidelines. Needles, other sharps go into these puncture-resistant containers, and other contaminated waste goes into special biohazard bags.
So no tossing used needles in the regular trash.
Oh, absolutely not. There are actually laws in place to make sure medical waste is disposed of properly. The Needle Stick Safety and Prevention Act, that was designed to protect healthcare workers specifically, encourage the use of those safety devices we talked about to minimize those needle stick injuries.
Good to know. There are regulations in place to keep everyone safe.
Mm.
But before we get into the nitty-gritty of the actual procedures, I think it's important to understand a bit about what's happening inside the body during a blood draw.
You're absolutely right. A little anatomy and physiology lesson can go a long way.
So let's talk blood and circulation. Give us a crash course. How does it all work?
Okay, so the cardiovascular system, that's our star player here. It's like a massive network of highways and byways, with the heart as the central pump and the blood vessels are the roadways.
So the heart pumps the blood and the blood vessels carry it.
Exactly. And the blood itself is carrying oxygen, nutrients to every single cell in your body. And at the same time, it's removing waste products. It's this constant vital flow, keeping everything functioning.
It's pretty amazing when you think about it. But when it comes to blood draws, we're usually targeting those veins.
Right. Veins are the blood vessels that carry the deoxygenated blood back to the heart. And there are certain veins that are, I guess, preferred for blood draws simply because they're easier to access.
Are there, like, specific veins phlebotomists look for?
The median cubital vein, that one runs along the inside of your elbow. That's usually the first choice. It tends to be large, close to the surface, makes it easier to find, easier to puncture.
That's one I always, like, brace myself for. But what if that vein isn't cooperating? Any other options?
There are. If the median cubital vein isn't accessible, there are others in the arm, like the cephalic vein or the basilic vein. And sometimes they even use veins on the back of the hand, though those are usually smaller, more challenging.
So they need to be adaptable, know their anatomy?
Yeah, they do. And that brings us to the blood itself. I mean, we often think of it as just this red liquid, but it's way more complex than that.
Okay, break it down. What exactly is in our blood?
Blood has two main components, plasma and what we call formed elements. Plasma, that's the liquid part, kind of like the fluid in a fruit smoothie. It's got water, proteins, electrolytes, other nutrients.
So it's the delivery system for all the good stuff.
Exactly. And then you have the formed elements, the solid particles floating in that plasma. These include red blood cells carrying oxygen, white blood cells fighting off infection, and platelets, which help with clotting.
It's like a whole world inside us, with each part playing a role.
It is. And sometimes, for some tests, you need to separate the plasma from the cells. We use a centrifuge, which spins the blood really fast, forcing those heavier cells to the bottom, and you're left with the plasma at the top.
That's so cool, like a high-tech blood separator. And is that how they get serum too?
Serum is a bit different. It's what's left after the blood has clotted, so it doesn't contain those clotting factors. That makes it useful for certain tests.
So depending on the test, you might need whole blood, plasma, or serum.
Exactly. And each type requires specific handling and collection methods. Gotta ensure those results are accurate.
Wow, it's amazing how much science is involved in getting the right blood sample. It's like setting the stage for the whole diagnostic process.
It really is. And that brings us to the tools of the trade, those instruments phlebotomists use to collect and handle those, well, you could say precious blood samples.
Let's take a peek inside that phlebotomy toolkit then. What might we see during a typical blood draw?
All right, well, first up, you have the tray. It holds all the supplies, needs to be organized, sanitized regularly, kind of like their portable workstation.
And what about those colorful tubes? I always see those.
Those are the collection tubes, yep. And they're color-coded based on the type of additive inside. Each additive serves a specific purpose, like preventing clotting or preserving certain components.
So the color tells you what's going on inside.
Exactly. For example, lavender tubes, those have EDTA, prevents clotting, used for hematology tests. Those analyze the cellular components of blood.
Right, the blood cells themselves.
Yep. Light blue tubes, those contain sodium citrate, another anticoagulant, but it's used for coagulation tests, which measure how well the blood clots.
So you're using an anticoagulant to test clotting.
It might seem counterintuitive, but it helps us measure those clotting factors accurately. Green tubes have heparin, yet another anticoagulant, and are often used for tests that require plasma.
Wow, so many options. How do they keep track of it all?
Lots of training and experience, of course. Most labs have charts, guides that list the tube types and their tests. And there's a specific order of draw they follow. Minimizes contamination between those additives.
It's like a secret code.
Yeah.
What else is in that toolkit?
All right, we have holders, used with the evacuated tube system, creates a vacuum, draws blood into the tube. Often has safety features to protect against needle sticks. Then there are syringes, sometimes used for delicate veins or for collecting blood cultures.
I'm noticing a theme here. Safety seems to be a big deal.
It is, absolutely. Speaking of which, let's talk needles. They come in a variety of sizes called gauges. The gauge refers to the needle's diameter. The thing is, a larger needle actually has a smaller gauge number.
So bigger number, smaller needle.
That's it. The choice of gauge, it depends on a few things. Size and condition of the vein, the type of test, even the amount of blood needed.
So no one-size-fits-all needle.
Nope. And there are different types, too. Single-draw needles, those are used with syringes. Multi-draw needles are for those evacuated tubes. They have safety features to prevent needle sticks when switching tubes. Then you have butterfly needles. They have wings for better control, often used for tricky draws, like in pediatrics or patients with fragile veins.
There's so many needles. What about those finger prick tests?
Those involve lancets. Small, sharp devices for collecting smaller samples, usually from the fingertip or heel. Used a lot for like glucose monitoring or for infants whose veins are too tiny for a traditional draw.
It seems like there's a specific needle for every situation.
Pretty much. What about tourniquets? Those help a lot too. They make the veins more prominent and easier to puncture. They temporarily restrict blood flow, make them stand out more.
I've always wondered how tight those are supposed to be.
It's a balance. Tight enough to make the vein pop, but not so tight that it cuts off circulation completely.
Makes sense. What about those other things like bandages and stuff?
Oh, we have sterile gauze pads, bandages to cover the puncture site afterward, and non-powdered gloves. Those are important to prevent contamination and latex allergies. Sharps containers are a must for safe disposal, of course.
So, kind of like a well-stocked first aid kit.
Hmm.
And I'm guessing there are specific procedures for sterilizing and handling all that equipment.
Absolutely. Sterilization is crucial. Most phlebotomy supplies come pre-sterilized, but it's important to check expiration dates and make sure the packaging's intact. Any equipment that touches blood, it needs to be disposed of properly in those biohazard containers.
Wow, a lot of attention to detail.
There has to be. We're dealing with people's health, after all. No room for error when it comes to infection control or getting those samples right.
Absolutely. Now that we know about the tools, let's walk through that venipuncture process. What are the steps in drawing blood?
Okay, so it starts with a friendly greeting and introduction. Professionalism is key, right? The phlebotomist sets the tone for the entire interaction.
Make the patient feel comfortable, respected.
Exactly. Then they'll verify the patient's identity using multiple identifiers: name, date of birth, medical record number. Again, no mix-ups.
No shortcuts there.
Nope. Then it's standard precautions time again. Washing hands, putting on gloves, preparing the equipment.
Safety first, always.
Always. The patient is positioned comfortably, usually with their arm extended and supported. Important not to hyperextend that elbow. It actually makes the veins harder to find.
Never knew that. So finding the right position is key. What's next?
Then the tourniquet is applied just above the elbow. Tight enough to restrict blood flow, but not so tight that it cuts off circulation completely.
Again with the balance.
Right. They'll feel for a vein that's bouncy, not hard or thready, avoiding any areas with scars, bruises, or, IV catheters, and no swollen arms or restricted blood flow either.
So a lot of assessment going on before the needle even comes out.
Definitely. And once the site is chosen, they clean it with an alcohol swab, let it dry completely before going further.
Why is the drying so important?
The alcohol needs to evaporate, do its job, killing bacteria. Plus, injecting alcohol into the vein would be pretty painful.
Ouch. Yeah, that makes sense. Okay, so now we're at the needle part.
Right. The phlebotomist attaches the needle to the holder and prepares those collection tubes, making sure they're in the right order if they need multiple tubes. Then they'll anchor the vein by pulling the skin taut below the puncture site. Helps prevent it from moving or rolling away.
It's like a balancing act, firmness and gentleness.
Exactly. Then the needle is inserted, shallow angle, bevel up, and the collection tube is pushed onto the holder. That creates the vacuum that draws the blood in.
What happens if the blood doesn't flow?
Could be a few reasons. The needle might not be in the vein correctly, or the vein could have collapsed. They might need to adjust the needle, loosen the tourniquet, or try a different tube.
So sometimes it's not that easy.
Not always, no. But experienced phlebotomists can usually figure it out. Once the first tube is full, or if they need more, they'll carefully switch tubes while keeping a good hold on the needle. And it's important to release the tourniquet before removing the last tube. Prevents backflow and bruising.
Okay, that makes sense. What happens after that final tube?
The needle is withdrawn, and pressure is immediately applied to the site with gauze to stop the bleeding. Once it's stopped, a bandage goes on, and the needle immediately goes into the sharps container.
Safety first. What about labeling those samples?
That can't be overlooked. The specimens are labeled right there at the bedside to avoid any mix-ups. Full name, medical record number, date of birth, date and time of collection, and the phlebotomist's initials all go on there.
So a lot of information to keep track of.
Absolutely. Any errors in labeling can have serious consequences. Incorrect results, even treatment errors. After labeling, they clean up, discard any waste, remove gloves, and wash their hands again.
So much emphasis on cleanliness.
There has to be, It's people's health we're dealing with. No room for error, like I said. So we covered the typical venipuncture, but what if that's not possible? Are there other ways to get blood? There are. Sometimes those veins are just too small or fragile for a regular blood draw, or the patient has a condition that makes venipuncture difficult. In those cases, we might use a syringe, have more control over the suction that way, or we might have to do a fingerstick or heelstick.
Okay, tell me about those. How do they work and when are they used?
Fingerstick collection is common for smaller blood samples, like for glucose monitoring. We use a special safety lancet, controls the depth of the puncture, and it's important to warm the finger first to get the blood flowing.
I've had those done.
Yeah, pretty common. And we always wipe away the first drop of blood because that can be contaminated with tissue fluid.
Oh, that makes sense. What about heel stick collection?
Heel sticks are usually for infants and small children. Their veins are just too tiny for venipuncture. Special safety lancets for infants are used to prevent injury to the heel bone, and the procedure's similar to a finger stick, but on the side of the heel.
So different techniques for different ages and situations.
Absolutely. And remember, no matter the method, safety and accuracy are always the top priorities.
Well said. But what about when things don't go as planned? Are there special situations phlebotomists need to be ready for?
There are definitely challenges, and they need to be able to handle them calmly, professionally. One common challenge is patients who are afraid of needles.
Needle phobia, right. That's a real thing.
It is, and it can be tough for some people. But skilled phlebotomists know how to recognize and address this fear.
So it's not just about the procedure, it's about understanding the patient's feelings.
Exactly. A good phlebotomist will take the time to explain, answer any questions, and just reassure them. Sometimes simple distractions help, like focusing on a picture or chatting. Sometimes a numbing cream can be used before the needles stick, too.
So, finding the right approach for each person. What about those patients who might refuse a blood draw?
That happens sometimes. Patients have the right to refuse, of course, but it's important for the phlebotomist to try to understand why and address any concerns. Maybe they had a bad experience before, or they're worried about the pain or the results.
It's a conversation, not a confrontation.
Right. They can explain the importance of the test, the risks of refusing, the steps taken to make it safe and comfortable.
Right.
And if they still refuse, that has to be documented in their medical record.
A balance between respecting their wishes and ensuring their well-being.
It is. Speaking of challenges, sometimes the veins themselves can be a problem. Small, deep, prone to rolling, makes them tricky to access.
I had my share of those frustrating experiences.
It happens. Experienced phlebotomists have some tricks, though. Warm compress, having the patient dangle their arm, things like that.
Resourcefulness.
Yeah. They might also use a smaller needle or a butterfly needle. And if all else fails, they might call in another healthcare provider or consider those alternative methods.
Problem-solving skills.
Definitely. One of the most important skills is knowing when to ask for help.
Knowing your limits, putting safety first.
Exactly. Another challenge can be when a patient faints.
I've never fainted, but I can imagine it being scary.
It can be. It's important to recognize the signs, like dizziness, lightheadedness, sweating, nausea. If they see those, the phlebotomist stops everything right away.
So, being observant.
Yes. And if they do faint, make sure they're lying down safely, loosen any tight clothing, and check that they're breathing okay. A cold compress can help, and they stay with the patient until they've recovered.
First aid and emotional support.
That's it. And once they're feeling better, document the incident.
Documentation's key, even then.
It is. And it's not just about documenting incidents, it's about the whole blood draw, verifying the patient, the site, needle and tubes used, anything unusual they notice.
Creating a record of what happened.
Exactly. This documentation helps make sure everyone's on the same page. If the patient sees another provider, they can see what was done, the results, any problems.
It's like communication between the healthcare team.
It is. And it's also used for quality assurance, tracking trends, making sure everything's being done safely and effectively.
So documentation is a tool for improvement.
Exactly. And it's a critical part of the phlebotomist's job.
Well said. I think we've covered a lot of ground here, from the basics of blood collection to safety and those specialized techniques. But before we move on, I want to thank London Heartbeat Z Academy again for their support.
They've been amazing, really dedicated to healthcare education.
They are. If you're intrigued by this world, by phlebotomy or any other healthcare career, I really recommend checking them out. They offer over 140 healthcare courses covering all sorts of topics.
And their instructors are fantastic, experienced healthcare professionals who really love what they do.
Plus, they offer online courses, in-person classes, even hybrid programs.
Yeah, something for everyone.
And don't forget to follow them on social media for free updates and insights into the healthcare world. You can find them on Facebook, Instagram, Spotify, and YouTube.
They're a great resource for anyone wanting to explore healthcare.
They are.
Speaking of art, those colorful tubes they use always remind me of a painter's palette. Each color stands for a different part of the blood that needs to be preserved or analyzed.
Okay, I've always been curious about those. We mentioned them earlier, but can we talk more about what makes them so special?
Of course. Remember we talked about the components of blood, plasma, serum, the cells? Well, each of those might be needed for different tests, and those colorful additives inside the tubes are what help us either prevent clotting or preserve specific components.
So it's not just about collecting the blood, it's about making sure it's in the right state for the lab.
Exactly. Take those lavender tubes, for instance. They have EDTA, which is an anticoagulant. It stops the blood from clotting, which is super important for tests that need to analyze the blood cells themselves.
So like if you want to count red blood cells, you can't have them all clumped together.
Exactly. Then there are the light blue tubes. Those also have an anticoagulant, but this one's called sodium citrate. It's used specifically for coagulation tests, the ones that measure how well your blood clots.
Wait, you use an anticoagulant to test clotting?
I know, right? Sounds a little counterintuitive, but it actually helps us measure those clotting factors correctly.
So it's about creating the right conditions for the test.
Exactly. And then there are the green tubes with heparin. That's another type of anticoagulant, and it's often used for tests that need plasma.
Wow, so many different types. How do phlebotomists keep track of it all?
Training and experience help a lot. Plus, most labs have charts and guides that list all the different tube types and what they're used for. And don't forget, the order of drawing those tubes in the right sequence is crucial to avoid contamination.
It's like a whole secret language of tubes and needles.
That's one way to put it. Every little detail matters because it's all about getting the right information to the healthcare providers so they can make good decisions about their patients' health.
Makes sense. You know, you mentioned earlier how important the phlebotomist's role is in making patients feel comfortable. And I think that brings up a bigger point about the human element in healthcare.
I agree. With all the advances in technology and complicated procedures, it's easy to forget that human connection.
It's true. A kind word, a smile, just listening.
Hmm.
Those things can make a patient feel seen and heard, even during something that might be stressful, like a blood draw.
It's all about creating a positive experience, which can actually lead to better outcomes in the long run.
And speaking of positive experiences, I have to say, learning about all this phlebotomy stuff has been really eye-opening. I never realized how much skill and knowledge is involved.
It's true. It's an often overlooked part of healthcare, but it's so fundamental to everything that comes after.
Absolutely.
Yeah.
I bet our listeners are feeling the same way, especially after hearing about all those safety procedures and techniques. Before we move on, I want to remind everyone about London Heartbeat's Z Academy.
They're such a great resource for anyone who wants to learn more about healthcare careers.
Exactly. If you're interested in phlebotomy or any healthcare field, you should definitely check out their website. Over 140 healthcare courses covering a huge range of topics.
And their instructors are amazing, experienced healthcare professionals who are so passionate about teaching.
Plus, they offer online courses, in-person, even hybrid options.
There's a format for everyone.
And don't forget to follow them on social media for free updates and insights. They're on Facebook, Instagram, Spotify, and YouTube.
They're a fantastic resource for anyone who wants to dive deeper into healthcare.
They are.